the intelligence of an animal doesn't have any relation to its capacity to suffer. So you can be sentient, an animal can be sentient, it will experience pain, it will experience emotions, it will experience suffering, it will experience mental distress in the same way we do. And all the research that has been done has shown that animals certainly have the same range of emotions and even depth of emotions as humans do. Now, they may get sort of excited or scared about different things than we do, but the actual lived experience is as real to them as ours is to us. And so many people mention their pets, and we've got a Labrador called Moose, and with the way he comes flying into the kitchen when he hears the fridge open in excitement, or the guilt he quite clearly feels when he's caught on the sofa and he's not meant to be. These and certainly as a vet, having seen animals in variety of species, there's horses, cattle, dogs, cats, chickens, in states of distress, in injury, are sick. Certainly the emotions and suffering they feel is as strong as any person. And so after years on the British Veterinary Association Policy Committee, which was back several years ago now, I was serving on that, where the British Veterinary Association very much supported the reduce and refine and replace model. We're in a very exciting time because it does feel as though we've finally got the technology that means that we really could move away from this in a meaningful way and in a very quick way. Everyone's talked about computer modelling, organs on a chip, AI, the way you can model protein folding and test various treatments and pharmaceuticals without having to use animals and potentially get even more valuable results. It's a really, really exciting time. And we need to, as a country and as a government, ensure that we're supporting our life sciences industry to do this. And we know that life sciences are coming forward with some of the best exciting breakthroughs in medicine to help solve a whole load of diseases that we never thought could be treated, cancer treatments as well, rare diseases, and they're also vital to growing the economy as well. But one thing I would ask of the Minister specifically is, as we do all we can to support the life sciences industry, both in developing new technologies and in moving away from animal testing, is there any work being done to ensure that we don't inadvertently offshore animal testing? Because as upsetting as that is to have animal testing in the UK, there are standards that are higher than anywhere else in the world. And what I would hate to see happen, and I'm sure everyone will be united in this, is that we somehow ban animal testing here and move away from it here, and it's simply offshored to somewhere where there's even less regulation and there's even more suffering caused as a consequence of that. I also want to bring up the issue of drugs that have already been tested, the licensing of them. So currently, drugs are tested on animals. If they pass animal testing, they go on to humans. If they pass human testing, they get a license. Now, they've been proven to work in animals, and yet the animals do not have a license, and the drugs cannot be used in them. And it seems as though if something has passed safety tests and been proven to work in animals, there should be automatic licensing, or what we call dual licensing, to show the animals that have been tested on should then have the benefits of those drugs. And currently that isn't the case. And we also have a situation as well where drug testing can pass animal tests, fail human tests, but then there's nothing that can be used in the animals, even though they pass those tests. Although we want to move away from animal testing, it seems wrong that animals cannot mutually benefit from a legal perspective from the testing that's already been done. And there's I hosted an event last week by the Humanimal Trust, which is calling for dual licensing. It's academics at University of Surrey, at the vet school there. And I'd be very keen for the Minister, if he's interested, to meet with that team, because they've done a lot of work on this issue as well. As we look at the updating the Veterinary Surgeons Act, there's currently a cascade where you prescribe drugs for animals, and sometimes pharmaceutical companies can get a retrospective license. So, for example, there might be a human drug that is used in animals, and it's used fine, it's working really well, and then the drug company will then do the research and get a license for that specific drug, and then no one else can use it, and it becomes very expensive. And so we'd like to look at how the Veterinary Surgeons Act and what we call the cascade of how you prescribe for animals means that drugs that have been proven to work in humans and animals can be more easily prescribed. And a really good example many people have here is that you go to the vet, they prescribe you paracetamol, it costs a lot of money, and then you discover that paracetamol is £16 in a shop. You're not allowed to prescribe, as a vet, paracetamol for a dog. It's not legal, the vet would get struck off, so they're not trying to fleece you. That is how the law works at the moment, and I'd be really keen that, along with the Veterinary Surgeons Act being updated, which it desperately needs to do, we look at prescribing rules and licensing as a big holistic piece of work. And finally, I'm very proud that the Lib Dems and Coalition did manage to bring forward that work to stop the testing of household animals on animals. I'm very proud to be an honorary senior lecturer at Bristol University at the vet school there in the area of One Health. So anyone doesn't know that, it's the recognition that human health, animal health and environmental health are all completely interlinked. And there's many diseases like antimicrobial resistance that affect humans and animals. We know that 75% of diseases, new and emerging infectious diseases, are those that can potentially cause a pandemic from animal origin. They're often related to farming practices as well. And it is impossible to improve human health, it's impossible to improve environmental health or animal health without seeing the three being completely linked and addressing them all. And I think that moving away from animal testing, but having more accurate